Please put your hands together for Fiona, John, Rowan, Ryan, please.
Thank you. Good morning, everyone. Just talk amongst yourselves. Okay, all good? Okay, so welcome everyone. Thank you for coming to hear about our program. So I'm just going to talk, thank you. I'm going to talk today about a new program that we're doing at Zoos Victoria, a wildlife outreach program aimed at building capacity in general practice veterinary professionals to assess native wildlife in our state. So where are we from? So Zoos Victoria in Australia, right down the bottom there in the state of Victoria. So we have 4 zoos. We have traditional zoos and an open range zoo and 2 native wildlife sanctuaries within our group of Zoos Victoria. So we consider ourselves a zoo-based conservation organisation. We have different arms, so I've just mentioned our zoo properties, which is where we have captive wildlife that visitors come and see. The department that I work in is our Wildlife Conservation and Science Department, so we have different departments within that conservation department. So we have our threatened species programs, so we have focused species across the state of Victoria that we have breeding programs, conservation biologists, ecologists, all working on the conservation of those species. We have our community conservation teams, so we have social scientists and animal welfare scientists working on behaviour change, interacting with visitors, changing the sort of perception for visitors coming to zoos and what to expect when they see our animals, moving away from selfies and those sort of things in the engagement with the animals in our care, so trying to engage in different ways, so a whole heap of behaviour change work that we do. And my team is our wildlife health and welfare team, so I have a few programs that sort of exist outside of our walls. So the outreach program, which I'll talk about today, we work with our government departments in the illegal trade of wildlife, our native species coming in and out of our borders, and also emergency response during disasters, so fire, flood, extreme heat events and things like that. So we have dedicated wildlife hospitals at 3 of our properties, and they look after the animals that live with us in our zoos, but they also have received incoming wildlife that are injured from members of public, our wildlife rescue and care network, and also support government agencies with wildlife presenting. And so the teams consist of vets and vet nurses who have sort of dedicated their career to wildlife. So less of that general practice veterinary medicine, but we're all sort of focused in that wildlife space. So our outreach program is, we had a really large bushfire event in 2019-2020, and through that event, we've done a whole bunch of work in our emergency response space, but also identified sort of huge gaps, which we always have known are there, but where there's limited skill and knowledge in how to assess native wildlife presenting to general practice clinics. And so we know that education lacks, so through curriculum at our universities, there's no real focus on wildlife. There's often just a unit or a elective that you can choose to learn about wildlife, but it's not present in the curriculum where you're really learning about wildlife and how to assess animals coming in. So what we see at our wildlife hospitals is poor prognostic decision making. So we get wildlife referrals and things that we get animals with broken legs and wings and things that have already been assessed by vets, so they haven't been looked at properly, and that's a big welfare issue. We see poor prognostic decision making in that general practice vets and vet nurses are not considering candidacy for rehabilitation. So can I do the surgery on the animal? Maybe, but is it a candidate for rehabilitation? So what are the comorbidities and other things that contribute to the presentation of that animal to a clinic that general practice veterinary professionals are generally not aware of thinking about. And the knock-on effects of that are give-it-a-go approach. So they might get a wombat, if anyone knows what a wombat is, that comes in that has a fracture. And where we might decide that's not an appropriate fracture to repair, a wonderful orthopaedic surgeon that does beautiful surgery on cats and dogs might think, yeah, I'm going to give it a go. But it's not a good decision for that animal from a welfare perspective because of the structure of that animal, little short legs. There's lots of decisions to consider, and the term in rehabilitation as well, so how long it takes that fracture to heal, managing pain as an outpatient, all sorts of stuff that is just not awareness there. The other thing to consider when we're thinking about candidacy for rehabilitation and the decisions that we're making for the presenting wildlife is impacts to wild population health. So again, that awareness to think about, well, the animal sort of looks sick, it had this injury, I can fix the injury, I'm not so worried about the disease, and then we're putting an animal that might be sick back into care and then released back into the population. So it's where those comorbidities need to be considered. So things like chlamydia in koalas that you might be aware of from our northern states, and making decisions about those animals going back into a population that might not have the disease present. Hopefully that makes sense. So we're really lucky to have support to do this program and a dedicated team in my team to be delivering this work. It's work that a lot of veterinary professionals, particularly wildlife veterinary professionals, are keen to share their knowledge and teach people how to do what they do. Our teams do it every day through phone calls with general practice vets and vet nurses, but we've got a dedicated team now hitting the road and getting out there to hopefully make some change. So our aim of this program is not to create a bunch of wildlife vets. We recognise that it's a dedicated career. It's not a specialty in Australia, but it is a career focus, and we recognise that. And so we're not trying to, tell everyone they can all be wildlife vets. We're trying to teach the general practice veterinary community how to apply their existing training to the wildlife patients that they're seeing. So sort of think about little light bulb moments about, we look at the whole animal, like age, body condition and things like that, not just the presenting injury. And also considerations of, removing an eye. You might do an amazing surgery and remove an eye that you can see is not viable, but you can't release that animal missing an eye. So it's sort of those sort of light bulb things. So how are we doing this? So we're taking an integrated approach across our state, so our little triangle of Victoria, through delivering in-situ workshops. So we have a whole sort of map of where we're heading out in our state. We're delivering tailored workshops in clinics, so in general practice clinics, so we can talk to them about how they can assess and see wildlife in their existing clinic. We don't want everyone coming to our wildlife hospitals and getting all excited about what they can do with wildlife in a purpose-built facility. We want to teach them how they can do what they need to do in that basic assessment in their own clinical space. We're doing local species sort of focus. So on coastal clinics, we might talk about penguins and stuff, but we're not going to talk about penguins when we're in the middle of Victoria where no one's ever going to see a penguin. And we're also able to tailor the content to what the clinic wants. So it's very interactive when we're out delivering. We have a suite of written resources. So we've done a lot of pre-work to understand what do clinics want, what will help them see wildlife, because we often also have situations where wildlife will present to a busy clinic. It's not their business to see wildlife. They've got clients and other animals that they need to see. So an animal will sit in the box out the back of a clinic and wait all day before anyone even looks at it. No pain relief, nothing. And maybe it's a straightforward euthanasia because it's got incredible trauma. But that's something that happens. So we've been asking lots of questions. What will help you make quicker decisions and facilitate you to assess that wildlife? So we're getting pain relief on board and things like that. And so one of those things has been decision trees, like quick reference resources, and accessible information that they can quickly look through when an animal presents. And so we've developed a suite of resources for most of our common species that are presenting to clinics. So really simple, identification, how to house, diet information for temporary holding, analgesia doses, how to anaesthetise the animal, expected weights, all sorts of things. Also immediate euthanasia triggers. So, things that we know will mean that the animal needs to be euthanized relatively quickly. We also have avian prognostic chart around fractures. And so that's something that gets presented a lot. So we've got a lot of information there that can help vets and vet nurses come to quick decisions on whether that's a fracture that has a good prognosis. The resources are version controlled, so we don't want to put information out there that is just going to get outdated. There's a lot of information out there already that is old. So we want to sort of hold on to these resources in a way that we're keeping them updated, and that also creates a connection with the clinics that we're working with. The other thing that we're building awareness of is Zoos Victoria as a referral hospital and where vets and vet nurses can call for advice. And I hope that after they've gone to our workshops, they've learnt sort of that basic assessment of the wildlife patient presenting. They build a clinical picture, they can call our vets and vet nurses, ask questions, we can advise them, and every time those calls are made, they're learning more and they're going to do better the next time and get more confidence in what they're doing and the decisions that they're making around wildlife. So the dream is a regionally connected network. And so we have our outreach program in the middle, and it's connected to our properties at Zoos Victoria. We also have a wildlife health and welfare advisor that sits on our team, which that role sort of is looking more at wildlife health and disease more broadly across the state. We're connected with our state wildlife agency, so that's DECA in the middle, or the Department of, what are they called these days? Department of Environment, Energy and Climate Action. They've just changed their name. And so we work really closely with that agency as the authorising agency for wildlife in our state. We're connected to the general practice veterinary professionals, our wildlife care and rehabilitator network across our state, all the volunteers. With the network hub at Zoos Victoria, where the resources and the expertise sort of sit. And the aim is to sort of raise that standard broadly across the state in the assessment of the wildlife patients that are presenting. We're taking sort of a strategic approach. So I mentioned DECA just before in the previous slide. So our state is broken up into DECA regions. So we're focused within the DECA regions, and that's how we're sort of starting to create the network within each region, and then it'll expand. So you can see the location of our 3 wildlife hospitals quite close to Melbourne, and then Kyabra and Fauna Park is up in the north, which we don't have a wildlife hospital there currently. And so we're working out in the regional spaces where we can see gaps for wildlife. So at the moment we're working in the sort of yellowy, greeny coloured section of Gippsland. We have high koala populations in those areas, and we also have high bushfire threat. So we're working to build that capacity to focus in that area so people are better prepared to assess those injured wildlife presenting. We have broad support for the program, including state funding, which is really amazing. So that funding is for 4 years and will take us through to 2027. So we've got a lot of work to do to build a sustainable program in that time, but we're really lucky to have that support. So the benefits we're hoping is to increase that capacity for general practice vets and vet nurses to be making better decisions for the wildlife presenting for the day-to-day emergencies for wildlife. But also complementing our emergency response preparedness, so for what I mentioned earlier, like fire, flood, and days of extreme heat. So that network connects to another network that we have that's focused on wildlife emergency response during those disasters. We're hoping that we create that better regional access for the shelters and the wildlife carers in the areas where they can go to vets that have more expertise that can help support them in the rehabilitation of their animals. We also with the wildlife trade work that I mentioned earlier, where we have vets that can support the government operations in the regional space where they're finding animals that are in very poor condition and need support to make that assessment of those animals that are presenting sort of out in the regions. And the overarching aim is improved welfare outcomes for wildlife across the state. So all of those programs all link together with that main aim. We are measuring our work. So we have a pre-work that we've done that I mentioned. We do surveys following our workshops, but we also touch base after the workshops, because we'll sort of find when we do the workshops that everyone's super excited to learn about wildlife and new things. So it's all positive. Yep, love the resources, loved what you delivered, definitely going to use it. But like in a couple of months, is it still useful? And that will help inform us how we need to tweak our content going forward. The other piece of work that we're trying to do is understand the barriers for clinics to seeing wildlife. We don't have any support program for general practice vets and vet nurses to see wildlife. So they don't get any funds, they do it off their own bat, or they charge wildlife rescuers a lot of money to see the wildlife, and they're volunteers. So we're trying to build our knowledge and understanding and think of, what's a good way that we can support the vets and nurses to be seeing wildlife. So is that through a grants program? Not sure. The sort of bigger dream is to have a sticker on your window saying, I'm part of the Zoos Victoria outreach program, and that helps you. We have an online version of the resources that they can sign into, and that also makes you eligible for funding for whatever it is that you need that will help the clinic to see wildlife. And we're also, trying to raise the profile of that, not a specialty in Victoria or in Australia, but wildlife medicine as a career focus, and where the expertise sit. And again, it's all about better welfare outcomes for the wildlife that we're seeing, and the good decision making, and the broader sense population health for our animals. The end. Thank you. Sure. Any questions? Go, Lou.
All right, so we're good. Thank you very much, Fiona. Very interesting sharing there.